Howdy everybody, and welcome to a brand spanking new episode of Fit & Co, where I talk about anything and everything about foot and lower limb health in a hopefully fun and entertaining way. Well, obviously it's your choice. Now, in this juicy episode, we're talking that annoying pain in your shins. Now, before I continue, if you haven't yet, and you know you'll enjoy my video and the awesome content that I bring to you, please tap that subscribe button and ring that bell button next to it to stay in the know when I post and drop new content. Okay, back to it. Now, this annoying pain in shins is what we know it as shin splints. However, shin splints is a broad term to describe this pain, much like a headache or chest pain. There are more specific terms for this condition. I'll let you know later. Now, the pain discomfort can affect the front of your leg and extend from just under your knee to the top of your ankle, and it's usually a gradual pain process. Now, the risk factors that make you more likely to experience shin splints in the literature or research, and especially in my experiences, include flat feet or lower inside arches, more intensified training, general lack of fitness, exercise, and sports on hard surfaces, and tight calf muscles. Now, to describe the pain and the symptoms I commonly see is that most of my clients talk about gradual discomfort that can extend from days, weeks to months. Obviously, at the start of the pain, it's only felt after activity or before activity, and as it worsens, it can become painful before, during, and after activity, as well as during the actual day, your normal day. Now, this pain can get really annoying and debilitating in some cases, affecting your morale, quality of life, and confidence in movement and exercise and your lifestyle. Now, the 4 common specific diagnoses for shin splints include, and a little explanation too, medial tibial stress syndrome, which is an inflammation of the band of tissues that surround bones, basically the covering. In this case, the periosteum, which is the covering of the shin bones, become inflamed from overexertion or overuse of exercise. Posterior tibialis dysfunction, when the posterior tibialis muscle, which helps stabilize and supports the foot arches of your feet, is overloaded and overexerted, it can give you those symptoms. Next one is chronic exertional compartment syndrome. Compartments are areas of the limb that make up a group of structures such as muscles, nerves, and blood vessels, which are wrapped around and covered by a fascia. When these structures swell up from injury or simply overworking during exercise, they expand within the fascia, which the fascia doesn't stretch easily. And when it happens, primarily in the acute compartment syndrome, blood flow and precious oxygen is limited to tissue. And if prolonged suffocation, basically, it can cause tissue starvation and also tissue death. But please note, if you do suffer an injury or sudden increase in sharp pain in the shins, then best to consult your local podiatrist or medical practitioner ASAP to assess. With chronic, believe it or not, it's actually easier to resolve and is nowhere near as dangerous, and not dangerous than acute. Next one is stress fractures of the tibia. Again, this relates to sudden overexertion in sport. Example, which causes repetitive buildup and pressure, causing a crack within your bones. Whew. Okay, now we made it. Now, what can you do? What you can do to stop and resolve this annoying shin splints? 3 things. First one, the DIY method, the do-it-yourself, not destroy yourself, the do-it-yourself method. RICE. Yep, RICE. It stands for something. R is for rest. Nothing better than taking a break from your new exercise program to rest and recuperate. I is for ice. It's oh so important. Get a high bucket of cold water with a few ice cubes or ice packs and soak your whole legs in there for about 10 to 15 minutes, and then rest for half an hour to 45 and repeat again. Obviously, you vary based on how you feel. If you haven't got a bucket, get a pool. C is for compression. It's an option, and I suggest you to wear a one of those sports compression stockings or socks or leg sleeves. It helps keep the muscle compact, reduce swelling, and increase blood flow. And E is for elevate. And whenever you can, keep your legs elevated up higher than the heart to help reduce swelling. Performing the RICE technique, which is first aid, basic first aid, will certainly help you ease symptoms. But if you want to do this right and not waste time, let's move on to number 2. Okay, so here's what a podiatrist like myself would do. I first understand your situation, your lifestyle, your goals, and then assess that with your lower limb posture so that you can understand, and we can understand, how you really move, how your feet impacts the ground, the muscular strength and flexibility ratio between different areas of your legs. And if necessary, you may be referred for scans, obviously to rule out any stress fractures or for any compartment syndrome. Now, it is so important for my clinic and for you to understand and to clarify your situation and the biomechanics of your body. So you see, with this, the podiatrist, like myself, can recommend a stretching and strengthening rehab program, or what I call a servicing rehab program, where the focus would be to stretch, to loosen those tight constricted muscles, and then strengthen the weak muscles of your legs. It's that ratio balance, it's so important. Now, I use a special tool called shockwave therapy, which is a safe, research-backed, innovative weapon against lower limb and foot conditions such as shin splints. I might do another video separate, I'll keep that in mind. Now, my strategy for my clients who suffer from shin splints involve rewriting and modifying your exercise program, customizing your rehab plan, and applying direct manual treatment, including shockwave therapy, deep muscle release, and eccentric stretching. And then obviously there's going to be strengthening part. Now the next one of the most common risk factors, as you know, if you learned this video, for shin splints is flat feet. With its low arches and tilted heels and the inward tilt of your feet, it's essential. Once your situation is audited and it's then best suited or recommended to suit your lifestyle and goals, I would then recommend orthotic therapy. Orthotics or orthoses have been a proven effective treatment modality. The goal here, folks, is to redistribute your body weight, support your feet, and counteract the flat feet by elevating your inside arches and then tilting the heel to reduce pressure on the bottom of your feet, as well as reducing excessive pressure on your tib post or posterior tibialis muscle and its periosteum. Remember, folks, it has to work together. Now, normally I would do a DIY self-do free method of relief video, but in this video I decided against it because getting the right guidance and strategy is vital to resolving your issue and, most importantly, stopping it from happening in the future. I mean, you wouldn't self-treat your toothache, would you? And in the end, the idea is with resolving and preventing shin splints from happening again, it's not simply by putting orthotics in and see you later. No, they have to all work together. Treat it, like I've always said, like a car. If you are a car, you have a car trouble, you need to make sure the wheel alignment or your feet or the wheels are sitting in the best position, the most effective position for you. That's orthotics. And then making sure to service your vehicle to make sure it performs at its optimal capacity. Okay, folks? Now, I really hope you enjoyed this video. I know it's a lot of information, but instead of breaking up into 200 videos, I want to just compact into one so you can get the full experience of what a podiatrist like myself would see and would strategize to help resolve your issue. Remember, folks, you're like a car, not a bomb, a nice fancy Ferrari or Lamborghini, whoever works, or Rolls Royce. You need to do the service of the vehicle, which is you, and then you need to wheel align the vehicle, which is your feet. Both have to work together to resolve your issues. Okay, folks? And just before I finish, if you haven't yet, please subscribe to this channel, tap that bell notification, and if you really enjoyed this video, give me a thumbs up because it's gonna make me feel better. And folks, most importantly, remember, walk smarter, not harder. I'll catch you in the next video.